Good morning and welcome to Onslow Memorial Hospital's live event on COVID-19 booster shots in the upcoming flu season. We're going to give it a minute for people to join our event with Dr. Stephen Spencer and Byron Lee. While we wait, I'll have Dr. Spencer and Byron introduce themselves briefly, and then we'll get started.
Sure. I'm Dr. Stephen Spencer. I'm the Chief Medical Officer at Onslow Memorial Hospital. I've been here for 6 months, and I'm really excited about this topic. I think it's been a little bit confusing for folks, and I think it's also important that we're incorporating the flu conversation, as that will be very important to continue to protect people against respiratory illnesses that can be deadly. So I think really excited about this, and I look forward to talking to Byron.
Absolutely. And I'm Byron Lee. I am the Director of Pharmacy here at Onslow. I've been a pharmacist here at Onslow for, I'm starting my 30th year now. And I've been Director since 2014. So as Dr. Spencer said, we've got an exciting topic, I think a very timely topic with really a lot of good information that has just kind of finally been put in a final opinion and form only like this morning, right?
Mm-hmm. Oh yeah.
So we've got
changes quite a minute.
Yeah, definitely. But good topic today, I think.
Okay, so we're going to go ahead and get started. Good afternoon. On behalf of Onslow Memorial Hospital, we want to welcome you to our Facebook Live event on COVID-19 booster shots and the upcoming flu season. Thank you to Dr. Burlingham Deal and the Onslow Memorial Hospital executive team for sponsoring this event. And we're grateful to each of you for joining us today as members of our community. Our speakers today, as they just introduced themselves, are Onslow Memorial Hospital's Chief Medical Officer and Senior Vice President, Dr. Stephen Spencer, and our Director of Pharmacy, Byron Lee. Feel free to leave any questions in the comment section, and we will take time at the end of the event to answer as many as we can. At this time, I'd like to hand it over to Dr. Spencer and Byron.
So I get the pleasure of having a great conversation with Byron again. He is a plethora of knowledge, especially around vaccines and all the evidence and guidelines that are out there. So I'm going to ask some questions and sit back and learn from Byron. So my first question before we get to the COVID vaccines and the flu vaccines, is there anything you want to share in general about COVID? Since we talked last, any updates that you think are important?
Well, I think it is important, again, we've got our topic matter today primarily dealing with boosters, and that's certainly going to be of great concern, and acknowledging and being aware if you are an individual that is in that category. COVID continues to develop and mutate, and there are certainly strains that are out there now that are variants of interest that are becoming potentially prominent that we're finding. It does still continue to be an issue. I know here at the hospital, as Dr. Spencer can attest to, as our morning huddle this morning, the cases do continue to rise. We're seeing a lot of folks, certainly a good number of folks, a largest percentage are unvaccinated folks that are being hospitalized with COVID. And we are seeing a number of individuals who have been vaccinated that are getting sick. Now, their symptoms do seem to be milder than others, and based on the statistics, you're about 11 times more likely to end up hospitalized if you are unvaccinated. But we are kind of seeing some of those breakthrough cases as well. So COVID definitely continues to be a concern, not just in this country, but worldwide. And again, so much concern with regard to the necessity and importance of potentially boosting that immune response. And then, of course, as we get into that discussion, there's a number of kind of different views on which direction we need to go. So we'll certainly address some of those as part of this process. But again, I think the main thing to remember, it is a very serious illness. Most importantly, if you have not been vaccinated, please strongly consider the benefits of vaccination. And if you have been vaccinated and some time has elapsed since you were fully vaccinated, there are going to be groups that we'll talk about today that should consider a booster.
Great. And as Byron said, we continue to deal with the ravages of this pandemic. We continue to have a large number of COVID positive patients who are in the hospital, many of whom are very, very sick. So certainly a topic that we need to keep discussing. So you talked a little bit about what we've seen in terms of the efficacy and effectiveness of those vaccines. So the Mrna vaccine, the Pfizer vaccine, Johnson & Johnson, we have seen lots of studies over the past year that have shown various levels of efficacy, and we have seen some studies more recently that have looked specifically at the Delta variant. What can you tell us about those studies and how maybe the numbers look a little bit different than they did at the beginning of the year?
So I think what's important, Dr. Spencer, is to understand that there are kind of two processes or parts of the immune response when we get a vaccine. Initially, up front, the concept is that we develop antibodies with the COVID virus vaccine. The plan is that you give this vaccine, and as a result of the processes that it kind of induces in the cell, your body manufactures antibodies, which, as many of you are aware, and if you're unaware, antibodies are that part of our immune system that respond very specifically to those threatening things, bacteria that invade, viruses that invade. Antibodies are kind of one of our first lines of defense for something that gets in. And that response is a very strong response initially. A lot of the percentages, you recall when the vaccines were first coming out, they talked about initial doses having a certain percentage, and then after the second dose having 94, 95% efficacy of preventing infection, because again those antibody were initially very prominent. Now, as part of that process, what we're also hoping to induce, and this is with every vaccine, not just the COVID vaccine, we're hoping to induce what we call a memory response, so that we get our T cells, those are white blood cells that basically attack the infected cells, the cells that have been infected with COVID, and our B cell response, which are part of the process that produce antibodies. So as with any vaccine, over time, those antibodies that are in our system will wane, and those antibodies, again, since they are that first response, they really kind of directly affect how we are able to avoid being infected by the disease. Whereas the memory response, which lasts much longer, and of course, again, it's a very new vaccine comparatively, we don't know exactly how long that memory response lasts, but what we are seeing is that the efficacy of the vaccines at keeping one from ending up with severe illness and ending up in the hospital is still very, very good, because it is a memory response, even though you may initially become infected because it's been some time since your antibody levels were as high as they were when you first got the vaccine. So the whole discussion is how effective the vaccines are, and this is kind of the crux of the whole debate over, do you need a booster? Because what a booster does is it bumps that antibody content right on back up to where it was. You still have the memory response, however, and many folks, of course, looking at a worldwide view, are saying, well, you've still got the memory response. Yes, you might get an infection, but it's generally going to be mild. And isn't it more important that we vaccinate countries that may not have as much access to the vaccine? Shouldn't we concentrate on making sure that these folks are not, let's just be honest, not dying from COVID as opposed to a group not getting, maybe as sick from COVID, which is our priority. And there's plenty of debate on either side, because obviously the more folks that get it, if we've got a large population that can get it, even if they're vaccinated, don't we want to keep them from getting it to potentially lower that group that is carrying and spreading the disease? So it's a two-sided debate, and that is where this whole concept of the booster comes in. Do we want to bump up that initial response so that we keep more folks from getting COVID, as opposed to just relying on this memory response, which keeps them from getting as sick if they do get COVID?
So that is going to be a very important concept that Byron is previewing, because what is our goal? Is our goal to prevent all COVID infections, or is our goal to prevent severe illness and hospitalization and ultimately death from COVID? And as Byron said, certainly in the beginning we talked a lot about preventing illness, and now I think the focus has really shifted to preventing severe disease.
Yes.
So it does bring us to that point of boosters.
Yes.
Now, Byron and I have been discussing this for the past couple of weeks, and following the news and the science and the papers and the research and all of our regulatory bodies that look at this information. And we made this Facebook Live coincide with when we thought we would have an answer to that. I'm not sure that we have the answer. So Byron is going to work us through evidence and what these governing bodies are telling us we should do about boosters.
Yes. So again, as we talked earlier, and as you just alluded to, Dr. Spencer, it is a very timely discussion, because all of the various regulatory committees, of course, we have the current Biden administration that have stated specific goals regarding booster usage. Naturally, we have the CDC, the Centers for Disease Control, which are involved in making those decisions, and their specific advisory committee on immunization, the ACIP, which again provides that advice, a panel of experts that are very knowledgeable about immunization practices and how things should go. And then ultimately we have the FDA, which in this country is our regulatory agency that provides oversight of which drugs and things are approved for use in this country. And definitely a very well-respected board. But again, there are different opinions on what should happen and who should be vaccinated and so on and so on. Before we start that, I want to make a distinction, because particularly in the media right now, there is a lot of use of the word booster, and sometimes there's a little bit of confusion over, wait a minute, I thought they said I was supposed to get this, or is it a booster, is it not? So let me just kind of clarify one point before we even go any further about booster shots. If you are an individual who is immunocompromised, that means that you are either, maybe you are taking a medication like an organ rejection medication because you were a transplant, you received a kidney transplant, or liver or heart, or whatever the case may be. You're taking medications that can diminish your immune response. You may be taking steroidal agents. Maybe you have a disease state like maybe psoriasis, and you're taking a medication for psoriasis or an inflammatory process, and your doctor has said this medication will diminish your immune response. For those people, they absolutely, and I don't think there's been any question about this, for their absolute and ultimate protection, these people should get a third dose. You should literally consider yourself, as far as if I'm immunocompromised, my course of therapy is not 2 doses, it is 3 doses. And just think of it that way. Don't even get confused with the whole booster concept right now. Just understand that if you are immunocompromised, you may not have had adequate response to the first 2 shots. And so as early as 1 month after you received that second shot, you can get a third shot and should get a third shot if you are in this category. At this time, if it has been a period of time between when you got your second shot, but you are in this immunocompromised category, absolutely, right now today, go ahead and seek that third dose, which again, it's called a third dose. It's not really a booster per se, because what we're trying to do is get your initial response where it should be, because as an immunocompromised person, you may not have responded adequately. So let's just make sure that we understand that we're not talking about that group. That group is an absolute, they are a 3-dose group. Let's just kind of put it out there in that way. Think of it that way. With the booster shot, however, what we're talking about is certain groups that are not immunocompromised, but they may be prone to have a decrease in their immune response much more quickly than someone who is, let's just say, an 18-year-old out there, athletic and has no health conditions. Their immune response, unfortunately, as much as folks like me that are starting to show a little age, their immune response is going to be more effective at maintaining itself. For folks who are 65 years old, and that is the current recommendation based on what we've heard. We've had a discussion from the Biden administration, who would love to have everybody, pretty much everybody, get a booster, because, hey, just in case, let's go ahead and let everyone get a booster if it's been at least 8 months since your second shot. That's kind of the stance that the Biden administration took. However, again, we have to moderate that with the world supply of vaccine and who are really the folks that are more likely to need boosters. Is it that 18 to 20 to 30-year-old, or is it the person who is 65 and older? And I think all of the committees, ACIP, CDC, and the FDA, all agree that anyone who is 65 years or older should consider getting a booster shot if it has been at least 6 months since your second dose. So that is plain and simple. If you are over 65 years of age or older, you should very certainly consider getting a booster shot. That shot is, again, only for Pfizer products, because Moderna is still has not gone through this process addressing boosters. The Pfizer product is a dose that is exactly the same as the dose that you received when you got your first and second shot, a 30 microgram dose. And again, the concept is that if you're older, your immune system may diminish a little bit more quickly than someone who's a little younger. Now, there's another group that should consider getting the booster, and I think all of the committees agree on this as well, and that is folks who are kind of in that, they're over 50 and they have an underlying condition, let's say diabetes or obesity, or they are they're on dialysis or dealing with, moving into kidney failure. Maybe it's someone with HIV or someone with a chronic disease. Any of those people in that 50 and older category should also very definitely, if you have an underlying disease, you should also consider getting a booster. Again, the concept is, let's get your immediate response, get those antibodies built back up to the level so it is not likely that you will even get COVID. Certainly, if you do end up getting COVID, it is much less likely that you would have a severe response or a severe case of COVID, and certainly not end up hospitalized by bumping things up just a little bit. Because again, those folks that are organ transplant patients or they're dealing with HIV, they're obviously more challenged as a rule by any ailment that comes along, and they're going to have a harder time because their system is not quite as robust. Now, the age range that is in question is the kind of the 18, between that 18 and 49 sort of age range. And at this one, some of the discussion disagree as far as should they get it? But the most recent discussion, which was just endorsed by the CDC, and the FDA has already kind of presented in this direction as well, is that if that group between 18 and 49 have an underlying ailment, as we were just discussing, cardiac disease, if you have cancer, if you have something that would, again, if you've got an ailment on top of that, it would be much more problematic. They may consider getting a booster shot. In other words, that is a recommendation that they may consider. It's not like, oh, you should do it per se, but these folks should evaluate themselves with the help of their primary care providers to determine, do I need a booster? And so you have, again, a decision to make. You still have very good protection from being hospitalized or having severe illness. But in that situation, when you have an underlying disease, even a small, mild case of COVID can be very problematic. It could certainly cause you to miss work and things like that, and maybe it would be worthwhile to consider having that extra dose. Finally, there is a category that is a little bit more controversial, and that is the category of individuals such as ourselves who are in occupations that end up with a high exposure to COVID. So for the most part, these are certainly healthcare workers. The FDA has said that if that is the case and you have an occupational exposure, it would also benefit for you to have a booster dose. In other words, again, let's get your antibodies right back up there where they were, so that, and here's the important thing, if these healthcare workers are taken out of commission, who is going to take care of the patients that are coming in? So that's kind of the concept and the decision making as far as why would we be interested in this particular group? And that's kind of the why, because these are the group that are taking care of the folks, again, that are getting sick. So the most recent discussion, as of just
2 minutes ago,
is that yes, those folks may get a vaccine. There will be, appropriate guidelines, appropriate liability protection, appropriate things for those that decide to administer vaccines to this group. And it is okay for them to get that vaccine, but again, it is something that each individual in that category that is having an occupational exposure to COVID on a regular basis in particular, something that they should consider. It's not saying you have to do it, you still have good protection, but it may be to your advantage and to the advantage of those that you serve, in that you get your immunity up so that you don't end up getting COVID at all. That's kind of the goal in that. And so it is something that, although the ACIP said, no, that group really doesn't need it if there's no underlying health conditions and they're 18 to 49 years old, they should have plenty of response. And their COVID reaction is going to be very mild, almost definitely. But the FDA and the CDC ultimately said, this group can get it, and we think that it would be a good idea.
Right. So I hope everyone now understands, and they're clear on who should get boosters. But it sounds like we are getting to a place where the vast majority of folks may, if they choose to, get boosters. The vast majority of folks in the U.S. will fit into one of those categories. It, of course, is not including folks who are less than 18. And again, as Byron said, we haven't even really addressed Moderna. And the other elephant in the room we haven't addressed is Johnson & Johnson. And there have been some updates to Johnson & Johnson over the past couple weeks. So you want to talk about Johnson & Johnson?
There have been, Dr. Spencer. I appreciate you mentioning Johnson & Johnson. So again, Johnson & Johnson, as everyone probably recalls, their effort with Janssen Pharmaceuticals is this vaccine that is a one-dose vaccine. And the one-dose vaccine, it's a little different from the mRNA vaccine. It is kind of made a little bit differently. It does not rely on mRNA. But it does rely on translation of certain segments of a DNA that's then converted to mRNA, and it produces the spike protein similarly. But the studies recently have shown, again, we know that the efficacy of that initial dose was somewhere between, we'll say 65, 75% efficacy, depending on what particular study was looking at the effectiveness. But the use of a second shot, just like with our Pfizer and Mrna product, ends up creating an incredibly good, somewhere around 94% efficacy at preventing infection. Again, basically puts it on a par with the two other agents that we already have. So that study was released very recently, and again, it does show good results. And at a point, if you have received the Johnson & Johnson vaccine, that may be something that you see that Johnson & Johnson decides to apply for the relevance of that second dose, because right now their emergency use approval is only for a one-dose series. But I think you may well see them pursuing that simply because of, again, you've got comparable efficacy, and again, the wider the availability of the vaccine, the more options we have, the better. So
not an official recommendation for Johnson & Johnson right now, but
Right,
based on
not
that
right now.
research, it likely will be in the future.
I think there's a very good chance.
So that was a great overview of COVID boosters. I think there's more to come. Of course, the other virus that we worry about, and before COVID was always a worry, starting around this time, was flu.
Absolutely.
And we saw last year some interesting things happen with the flu virus.
We did.
And sort of the epidemiology of it. Can you talk about the flu virus last year, what our flu season looked like?
Sure. What flu season?
Right. That's a great place to start. What flu season?
So
what happened to the flu?
If you look at a graph of how flu, the prevalence of the influenza virus in any particular point, you will see certain peaks, rises and falls, as you would expect during the cooler months. You see a big rise, because everybody's inside, and they tend to be a lot more in contact with each other. So you see a big rise, and then it falls off a little bit in the warmer months, because people are outside more and less in contact with each other. But last year there was a very interesting phenomenon. If you look at a graph of the flu prevalence, you will see this nice little spike, because we were going into the colder months, and then all of a sudden you see a precipitous drop. I mean, it literally looks like Mount Everest suddenly just dropping off, and then it's like literally riding the bottom of the graph. You're like, well, why is that? Well, interestingly enough, if you look at the timing, it coincides very well with the isolation and social distancing and masking precautions that were, suddenly becoming very prevalent throughout the world, and have continued to be, something that is, again, an important part of controlling COVID virus. So it's almost like the benefit of that response to COVID last year almost eliminated influenza. It almost eliminated it, which again kind of demonstrates the effectiveness of masking and social distancing and taking precautions, hand washing, that we've always touted. But again, the fear of COVID became something that kind of put the wheels behind the cart and put things on the move with regard to reducing our exposure to viruses in general. And influenza, thankfully, was one of the casualties of that response.
And it didn't seem to be an effect of less testing. In fact, we probably did more testing because
Absolutely.
we were testing for COVID, we were testing
That's
for
right.
influenza, And so it's a
Yep.
very interesting effect of sort of that, as you were saying, the
That's right.
isolation, the masking, and those things that prevent respiratory diseases in
Yes.
general, of course, would also help to
Yeah,
prevent
and of course,
influenza.
as you know, we hear, pretty frequently, our lab reports in morning huddle, and our lab director, reports the quantities of certain, lab tests we have, and we, very quickly, as COVID developed, you ended up with tests that tested for flu and COVID simultaneously. They were, again, very quick to develop those because we know that flu is a very serious illness. We certainly take it seriously. It does, produce, of course, not quite as bad as COVID, obviously, but it does produce, a lot of absences from the workforce each year, and of course, hospitalizations. And again, it is sometimes lethal in certain patient populations in particular. So, yeah, very definitely.
So what are your thoughts about this year? What do you think we'll see in terms of our flu numbers?
So there's a couple things that can, I think, that are important to understand about this year. Part of the process, again, of hopefully avoiding influenza is just like with COVID, getting vaccinated. It's important with the flu vaccine that you get it on an annual basis, because as you get it each year, your body's ability to recognize different strains, is slowly built up. So it's kind of a cumulative effect for what memory effect you get. But flu is a very crafty virus in that it changes itself through what we call genetic shifts and drifts. And sometimes the entire outer coat of the virus can be completely remade in as little as 6 months in some cases. But usually over the course of a season, in other words, about a year, you're looking at a totally different appearance for that flu virus as compared to what it was at the beginning. Well, in order to make flu vaccines, of course, we have to kind of know what those new strains are. What are the most current strains? But we also have to have time to manufacture the vaccines. So in last year's flu season, because there were not as many cases, we're not entirely sure that the cases that we did see represent the most dangerous or most prevalent strains. Therefore, our vaccine for this year, which again is based on what we saw last year, may potentially not be as effective simply because there were not enough cases to truly provide a worldview. And this is something that's done, again, the World Health Organization, the CDC, if I remember correctly, 144 organizations, somewhere around 114 countries that participate in monitoring influenza, determining what is the strain. Is it an A strain? Is it a B strain? What are the effects? How has this one changed from that one? And all of that goes together, is kind of combined in a massive world effort to make sure that we get the most effective vaccine that we can possibly produce. But again, if we don't have as many cases, we may not be seeing the most virulent or most dangerous strains that are out there. So there is a possibility that in addition to having had a year of not being exposed, now we suddenly are hit with a strain because it genetically evolved, just like COVID does. It is mutated in such a way that it may be so new to our system that our natural resistance is minimized, and the effectiveness of the vaccine could be impacted as well. So it could be, again, we hope it's not, but it could be a much more problematic influenza season this year than it was last.
Yeah, so Byron beat me to the punch with my next question. It was going to be my easiest question of the day, which was, do you think the flu season will be better, worse, or the same as last year?
I will say, there are two possibilities. As we just discussed, there is that possibility that it could be significantly worse, particularly if, there are groups, during the season that continue to avoid mask wearing or social distancing and protective measures such as we know that we're doing for COVID. So There is that possibility, but now there's also the possibility that if folks do take up that call to continue social distancing and continuing to remain vigilant for COVID, that you may also get a side effect benefit for influenza this year, in that those measures can certainly, as they do at reducing COVID, they certainly do even more at reducing influenza. So there is that possibility as well.
Yes. I think I'm going for probably higher, but hopefully not much higher if we keep doing
Yes, I
what we're
hope.
supposed to do. So tell me about there are different formulations for different groups. Tell me
Yes.
about the different formulations for influenza vaccine.
So I want to just kind of mention right off the bat that no specific formulation, aside from pediatric dosing, which is a little bit different in some cases for certain of the various formulations, but aside from that, there's no actual preference for, and again, probably the population we need to address are those that are age 65 and older, which are the older population. There are some formulas that have been released that are designed for that older population. There's a couple of formulations that we'll talk about. So you've got, again, some that are out there for that purpose, but there are no specific preferences, and getting any one of them, if it is available, is to your advantage. So you've got the regular vaccine, which is a quadrivalent vaccine.
What does that mean?
When they say quadrivalent, basically it means that there are 4 different strains of flu virus. There are 2 A strains and 2 B strains. There are the A strains include the H1N1, which you recall probably those that were here in that time frame, was a very serious strain because that particular combination was very lethal during certain times that it has cropped up. And there's the H3N2, which is another A strain that can be very serious. And then there are 2 B strains, which are a little different and normally not quite as prevalent, although we have had recent years where the B strain was really devastating to younger people. So it certainly can be a concern, and initially we had kind of 2 A's and 1 B in the initial flu vaccines years ago, but now it's pretty commonplace to have those 2 different strains of A and 2 different strains of B, hoping to cover all of the various strains that could be out there in the wild, so to speak. So that's kind of how that works. Quadrivalent just means that there are 4. So you have a standard quadrivalent vaccine that is made using eggs. Now, if you have an egg allergy, and it's a generally mild allergy, rash or something like that, you probably will not have any problem with these vaccines, regardless of where they originate from. But the ones that come from eggs, if you have a very severe egg allergy, then if you're going to have to get one of those, it definitely is a recommendation that it be done in a facility that can handle a reaction if you have a reaction. So be aware if you are severely allergic to eggs, it could be of concern because the majority of the vaccines out there are produced using eggs as a medium to grow the viral product that is used in the vaccine. Now we also have a couple of variations. We have a variation that's grown in a different medium, which are cultivated animal cells that I believe were derived from canine kidney cells. No canines were harmed in this, mind you, but it's a cultivated group of cells that is used to produce certain of these vaccines. And then there's also a vaccine that relies on recombinant technology where there are no eggs used in that process either. So there are versions that are completely free of any egg involvement, and if you do have certainly a severe egg allergy, it would be best to seek those out if you had that option. And just to give you a name to go with those 2, is the one that's based on the grown in the cultivated cells is called uh, Flucelvax is the brand name, and the one that is derived from recombinant technology is called Flu Block. So both of those are egg-free. And then there are a couple of combinations, as we talked about, that are designed for elderly people in particular. One is a product that has an additive, what's called an adjuvant, and it is a product that's added that basically enhances the immune response by it's almost like a bugle call
Right.
to certain elements of your white blood cell resistance. So it kind of calls those in, and they're much better able, with lower doses of the flu vaccine itself, they're better able to recognize it. That's called an adjuvant product. And then there is the high dose flu vaccine. All of these again are quadrivalent vaccines that is a higher dose, and that again is because if a patient is over 65 years old, there's a good chance that their immune response will not be as robust as a younger
Same idea
patient.
with the COVID
Yeah,
vaccine.
exactly right. And then finally, there is actually, all of these are what they call inactivated flu viruses. The virus has been killed, but there is actually a nasal spray that for a while there was some question about whether it was efficacious, but it has been kind of reformulated and reworked. And so it is actually a live virus, and the particular flu virus that is in this again has been attenuated, and that just means it's been weakened so that it can only grow in specific areas. In this case, it's the nose because it's a nasal spray, but it is actually killed at body temperature. So it acts in the nose. It reproduces only in the nasal cells, and provides you with protection of being able to develop antibodies to the influenza virus, again all four strains, but it will not give you the flu. It
Right.
cannot reproduce in your body. Once it hits that body heat, it's basically inactivated.
Which was a famous refrain from lots of my patients, and I had to always explain to them that flu shot cannot give you the flu.
That's right.
You
That's
could have
right.
still gotten the flu, but
Yeah,
the flu shot
yeah,
didn't give it to you.
that's right. Just as with any vaccine, and just as with the COVID vaccine, you can still get the virus that you're being vaccinated against, but the response that you have will be hopefully much less intense. And again, we've got the statistics that bear that out, that getting a vaccine allows you to have protection, certainly compared to someone who was not vaccinated, protection such that if you do get infected, it's going to be a far milder case.
And the interesting thing is you're working on mRNA flu vaccine.
They are.
Which we
yes.
think will maybe be more effective because they'll be able to turn it over much faster.
I was going to say, not only is it likely to be more effective from the standpoint of the ease of production, but also, again, you're not dealing with a medium that people could be allergic to. It's much less chance of, there are no eggs used, there's no artificial cells used. It's literally, again, your own body that's producing the antigen and then producing the antibody in response. So again, the technology that, as we discussed before, that was used in creating the COVID vaccine and a number of other vaccines prior to that, that just didn't get quite the publicity, but the technology is amazing, and again, that quick turnaround lends itself to very quick response. And again, we talked about how flu vaccine has to be developed for a previous year's strains. We may even be able to see flu vaccines that are literally taking advantage of, well, we recognize the genetic code of this strain today, and being able to close that gap so that our flu vaccines are more effective because they are more recent in their design.
And then on the flip side, maybe the delivery system for the COVID vaccine may focus on a nasal delivery as opposed to intramuscular delivery, which may be more effective in actually preventing the illness.
That's right. That's right. Because if you isolate it so that it's not, circulating throughout the body, again, you have a much lower chance of reacting to the vaccine. And again, just as effective in the case of, the studies that have been shown versus the muscular injection versus the nasal. They have very, very similar effectiveness. So, if it's easier, why not?
So the big question that everyone's going to have is all these vaccines, this vaccine and that vaccine, and timing, and when do I get them, and should I separate them, should I get them at the same time? What is your advice?
So let's start with flu vaccine, just because we know it's getting ready to come out, and we know that flu vaccine gives you, again, as we have kind of heard about from COVID, flu vaccine gives about a 6-month peak protection, and generally, influenza tends to peak around March or so. Now, influenza is always around us. It is always around us, and you can encounter it at any time of year, but it's more likely to be encountered during these certain times, particularly during colder months. So ideally, you should be vaccinated for flu. Right now is a great time to start. If flu vaccine becomes available in your area, you can be vaccinated. Hopefully, ideally, everyone gets vaccinated by the end of October, but October is kind of that target month because October, November, December, January, February, March. So we've got that 6-month protection during the colder months, and then after that point, just as many vaccines, your protection, your upfront protection starts to diminish, as well as the fact that in that 6-month period, flu could have completely changed its exterior so that it makes the vaccine not as effective at that point either. So that certainly is a good point from here all the way through. As long as you're getting it, you're doing yourself a favor by helping reduce the possibility of getting influenza. Now, for those that haven't been vaccinated at all for COVID, or those that are seeking a booster around this time, technically, you can give both of those shots simultaneously. They will not interfere with each other's action. But you may necessarily not want to get them both at the same time. And the reason is because, again, sometimes folks can have, particularly for the second COVID injection, and particularly possibly for the booster injection, because your system is already familiar with it, it may have a reaction the same way your body always reacts when it perceives a threat of this nature. You could get a fever, you could get some soreness. Those of you that have gotten that second vaccine, my arm was a little bit more sore, when I got that second vaccine. So kind of add all that up, and then possibly having a similar reaction to flu. It may be a little bit worse if you get them both at the same time with regard to the possibility of a reaction. So you may want to separate those. Originally, they had said, we'll probably want to separate them by at least 2 weeks. It's not necessarily have to be 2 weeks, but 2 weeks is kind of a good estimation of when you should, be well through with any symptoms, if any, from one vaccine, and not, having concomitant symptoms from the other when you take the other. But you can literally get them the same time. If you have the opportunity, there's a week difference, that's fine too. But if you're at your, provider that has the flu and the COVID vaccine, and you want to get them both, yes, you can do it. If a couple of weeks from now, I'm not going to be able to get back out here, I'm not going to have a ride, or I'm challenged by, other factors, or I've got another appointment scheduled, then I won't be, then yes, you can get them both at the same time. It's important that you get them, and that's the real thing. If you're not going to be able to wait, or get it and not have an opportunity in that 2-week time frame, 4-week time frame, whatever it may be, it is okay to get them both simultaneously. It will not interfere with their ability to work, but may give you a little bit more soreness, aches, maybe a little bit of fever, and of course you would respond to that appropriately with, Tylenol or ibuprofen, that kind of thing.
So it's patient preference, and then sometimes it's doctor preference.
It is.
Because sometimes when a patient tells me, oh, I'll separate them and I'll wait, sometimes I'll say, oh, that's fine, it's you. But sometimes I'll say, no, I know you're not coming
Yeah,
back.
that's
Let's
right.
do them all now.
That's right, that's right. And that, again, that's why it's so important, as we're all aware, so important of having that relationship with, the provider and the patient, knowing your patient, and being able to make, wise decisions on their behalf. So certainly, again, it is so important that we're all kind of working together, with our patient as part of that decision team, and making sure that we put those thoughts in there to say, hey, let's go ahead and get them both. I think you're going to be fine with that, particularly if it's a younger patient that is not likely to have any, problematic reactions anyway.
Perfect. Well, as always, Byron has given us a lot to think about and a lot of information. I think we're close to the finish of our time, but Sophia, if you have any questions that came in from Facebook Live, you can let us know.
We have not received any questions yet.
And that's because Byron is so thorough.
Yeah,
He has answered all of the questions.
But if there are any more questions afterwards, feel free to leave a comment and we will get back to you with an answer. Do you guys have any last words you'd like to impart on everyone?
So, as always, I'll do a PSA, and Byron has mentioned this several times. We certainly have seen an increased amount of COVID patients in the hospital in the past few weeks. It certainly has put a strain on all of the health systems, basically in the country, but certainly in this region, particularly have been strained by the number of patients. So, encourage everyone to get vaccinated. Like Byron said, it's not 100% that you won't get COVID, but certainly it decreases your risk of ending up in here tremendously. And I also encourage folks to get flu vaccines when they're available as well, because I do think we're going to have a more severe flu season. And I think what we may see, and this is just Steve Spencer talking without any evidence, I think what we may see is as our COVID numbers start to go down, we now see a rebound of flu as well. So encourage everyone to get vaccinated for both of those things, and to certainly be vigilant about protecting yourself.
Absolutely. Don't forget the hand washing, mask wearing. We can't understate the importance of, doing those things that you should do to protect yourself against the possibility of infection. God forbid an individual end up infected with flu and COVID simultaneously.
That was our big fear from last year.
So, we definitely don't want that. As those vaccines, your flu vaccines become available, and you will find that a number of places are now offering vaccines, please consider getting the flu vaccine, and again, as well, I cannot understate the importance of COVID vaccines in reducing your possibility of ultimately ending up in the hospital. Just cannot understate that. So important.
Thank you.
All right, thank you both for taking part of your day to share this information with everyone, and thank you to all of our viewers for watching with us. Have a great afternoon and stay safe.